All right, rising unemployment now forcing more and more people to turn to free clinics for medical treatment. But the extra workload, well, it's straining a system also suffering from a steep drop-off in financial support. Laura Engel is live in our New York bureau right now. And so, Laura, here's the question that many people are asking. How do these free clinics, first of all, work? And how can things like physical exams, x-rays, and even prescription medicines be free?
Well, a whole lot of donations, Kelly. And, you know, these medical centers are privately run. They do not receive any funding. Most of them don't, at least, from any federal or state funds. They are run by volunteers, and we're talking about doctors, nurses, physician assistants, all donate their time and their energy. And as you mentioned, we are talking about medical exams, x-rays, chronic illness checks, and those prescription drugs, all things that can really add up. So these clinics, by and large, really have to rely on community support, grants, foundations, things like that. But overall, funding right now is down 20% across America, while there has been an increase in patient load by up to 50%. So it's a big gap that really needs a lot of attention.
And you know, these services are valuable. So, I mean, can anyone go in and use the services of free clinics? Right.
Wouldn't it be great if everybody could go in and get free medical care? But no, there are some stipulations and qualifications to go in and use these things. You have to be uninsured. You have to be in the low income bracket. And depending on the rules of your state, you must live within the area of the free clinic. And medical experts right now estimate up to 8 million people will be using these clinics this year. And, you know, for many of these people, it is more than just saving their health. Take a listen.
I had to pay all those bills. I probably wouldn't be able to pay my mortgage or electric bills. I mean, like I mentioned, we're having a hard time just paying those right now, you know, trying to keep our heads above water.
And a lot of these people that are using the clinics never dreamed that they would have to use these services. They've lost their jobs, they've lost their insurance, and this is the only way they can turn.
Yeah, and you're talking about the lack of funding that's out there. So how do the people who run these free clinics think this is all going to pan out? I mean, how are they adjusting to the fact that there's an increase in patients and then there's also the lack of funding?
Right. It's a terrible seesaw to have to ride, but they are just getting creative, cutting hours in some cases, maybe doing, you know, there's some clinics that report usually they'll do visual exams once or twice a month, and they'll have to just cut those down. So they're just cutting down, moving patients over to different clinics that are also free clinics to try and lighten the load.
That can only increase the pain as well.
Right.
Laura, thank you very much.
Thanks, Kelly.